Good morning, everybody. Chairman Hawkins is getting some good legislation through the Senate. It's taking a little longer than it should, so I'm going to have the opportunity to chair the meeting for a moment. Before we get started, I'm going to have Chair Lady Mathiak open us up in prayer. If everybody will bow your heads.
Thank you, Mr. Chair. Heavenly Father, I just thank you for this day that you've provided, and I just ask you to help us have extra patience today with all these meetings that are going on at the same time, and just ask us to have calm hearts and calm spirits and make wise decisions today. And I commit this all to your Son, Jesus. In Jesus' name, amen.
Thank you, Chair Lady Mathiak. Just to be up front with everyone here, we're going to take up a couple of House resolutions first. We will begin with House Resolution 512. But as we're moving through the meeting today, our posture here is that we will take up these resolutions and then wait for Chairman Hawkins before we take up Senate Bill 39. So House Resolution 512, Chair Lady Hagan.
Thank you, Mr. Chairman and members of the committee. House Resolution 512 would create a study committee on the addiction epidemic and solutions for recovery. Up until just not too many years ago, I really did not feel like addiction issues impacted me at all, but that is absolutely not the truth. My father and my father-in-law were raised by alcoholic fathers who thankfully found recovery, and that was really good news. But I also lost a dear uncle directly as a result of his alcoholism a few years ago, and then also a dear cousin of mine died from an overdose not long after my uncle did. So this is an issue that I have had to admit is deeply impactful to me and my family. And as I've been here the last 4 years and I'm talking to different people about all kinds of issues, it continually comes up that we have not studied addiction in anybody's memory, really. And so I felt like that was a very important thing for us to do as a house. And I also felt like it was very important to include recovery in this study, because I don't think we need to just talk about what problems we face, but we need to talk about what hope and help there is out there, and make sure that we're adequately supporting our fellow Georgians as they are in recovery. So that is what this study committee would do. We want to look at where we currently stand on various addiction issues, and not just substance abuse, but all forms of addiction that we have found that Georgians are facing. We want to anticipate future issues, and then we also want to look at, honestly, at where as a state we're falling short, so that we can begin to address those issues. So this study committee would have 12 members, all appointed by the Speaker. 8 would be legislators, and 4 would be non-legislative members, as they're outlined there on lines 39 through 46. And this would authorize us to meet 5 days unless we find that we need more days and can get authorized for that. And then we would report out on by December 1st of this year. So that's the resolution, and I'd be happy to answer any questions if you have them for me.
Thank you, Chair Lady Hagan. Thank you for bringing this important resolution. Thank you for being willing to share the personal impact and your family's story. That's certainly valuable to us as a committee. Do we have any questions for Chair Lady Hagan? All right, Chair Lady Mathiak.
Thank you for bringing this bill. I think it's very important, and I understand. The committee would start in when, and it would end at the end of this year, correct?
That's right.
So it would be through the summer?
It would be in the interim. Yes,
Gotcha.
ma'am.
Thank you.
Mr. Clark.
Thank Thank you, Mr. Chair. Thank you for this bill. Question for the makeup of the study committee. I noticed that there are some non-legislators that are a part of this, and I'm wondering if you might consider a peer specialist. Georgia has a peer specialist program specifically for people who have recovered from addiction, and those people basically work with people who are suffering with addiction.
Yes.
I don't see that in the list, and I know it's the hours late as far as session, but I'm thinking of maybe one of those 4 non-legislative members being a peer specialist.
Absolutely agree with that. It's not laid out here, but that was our intent, was that we would choose a peer specialist that would fit into one of these categories, someone who was certified in an area that could sit there on the committee and have that input.
Thank you.
You're welcome.
Chairman Jones.
Thank you, Mr. Chairman. To the author of the bill, I'd like to just have a conversation with you about line 42 and 43. Would you object to a friendly amendment where at the end of 43 it says includes the treatment of addiction and dual diagnosis?
I don't have a problem with that.
Okay, thank you.
And will you talk to me just a little bit about
Of course.
that? I know that's an area that you're more versed in than I am.
So when we look at the mental health community and the addictive community, there is such intertwinement. I mean, basically they share a significant amount of DNA. And if that specialist who we are assigning as one of the 4 non-legislative members has, I'll say, a view of not just addiction, but also the combination of mental health and addiction, which is dual diagnosis, I think that individual, whoever that may be, will bring, I'll say, an extra special amount of subject matter expertise to the committee that may be voided if we don't have dual diagnosis inside of 42 and 43.
I think that's a good idea.
Okay, thank you. At the proper time, Mr. Chairman, I'd like to make that motion.
Thank you, Chairman Jones. The postures, we're going to take a couple more questions. We have 1 individual signed up to speak on the bill. Then we'll take a motion to move the resolution, then consider any minutes. But thank you for that. Representative Stinson.
Thank you, Mr. Chairman, and thank you, Madam Chair, for sharing your story about your family and bringing this bill. You mentioned other addictions. What type of other addictions you think will be included in this study committee?
We're thinking, obviously, alcohol, illegal and prescription drug abuse, but we're also looking at sex, gambling, internet and technology abuse, or addiction.
Okay.
We know that takes all forms. I think we're aware at this point that we have a problem with not just young people, but a pervasive problem with our young people, that they are addicted to technology and are not. So we're looking at all types of addictive
Gotcha.
behavior that we feel like we need to address as a state. I work with Jeff Breedlove, who I believe is the person who signed up to speak here, on forming this resolution.
Okay.
And what, in his experience, he felt like we needed to study.
Okay, very good.
Unless there's something you feel like we need to add.
No. I think that's good what you stated, and I'm very interested in this because I have a facility in my district, in my home county, in Taylor County, that works with individuals that are going through addictions, but it's primarily, I think, drug addiction. So I think they will be very interested in this resolution as well, in this study committee. So again, thank you for your work.
Thank you for that great question. Seeing no other questions for the author of the bill, let's call up our speaker, Mr. Breedlove.
Mr. Chairman. Mr. Chairman, please the committee. I'm Jeff Breedlove. I'm a person in long-term recovery from addiction here on behalf of the Georgia Council for Recovery, bringing good wishes of support from not only the council but the over 90 members of the Georgia Mental Health Policy Partnership and the Georgia Addiction Recovery Alliance. We believe that this bill is holistic. There is, and we certainly, if I may say, we support the concept from Representative Jones, who co-chairs the Mental Health Caucus. Thank you for that wisdom, sir. That would be a great addition. And to Representative Clark's question, I think the civilian appointee number 4 at the Recovery Community Organization all the employees of we agree with you. All the employees that work at recovery community organizations have gone through the state certification process at DBHCD to be a peer certified specialist. So we agree with you completely, and that was the intent for that particular appointee, that they be a peer certified specialist. So thank you for your inclusiveness of that. I will just say, in the interest of time, I was thinking about this. I want to say this. The other day, I was in Las Vegas. And under Las Vegas are several hundred miles of tunnels. And in those tunnels are several thousand people who live every day. And every one of those people are dual diagnosis with mental health and addiction issues. And most of those started from gambling issues in Vegas. And those are my brothers and sisters who are in active addiction right now. And my brothers and sisters in recovery go into those tunnels every day to bring shoes and basic life-saving things. So I think it's important that we look at this holistically. How does everything tie together? Because one thing can lead to another thing. And I just hope that you will honor our community and allow this to be studied, and we thank you for your consideration.
Thank you, Mr. Breedlove. Let me ask you just a question. We've heard two potential amendments. We have one maybe potentially being referenced by Representative Clark. Do you think we need to specify that they're a peer certified specialist, or do you think that's already baked in to lines 45 and 46?
Whatever the pleasure of Representative Clark is, but I can say to the representative directly and to the committee holistically, all the employees at these RCOs will be certified peer certified specialists. So I think her concern is addressed.
Okay, and then we had one potentially from Representative Jones. Can you just make sure we're clear on that? On lines 42 and 43, that includes the treatment of addiction and dual diagnosis.
Yeah, I would say to one of my mentors who chairs the Mental Health Caucus how thankful we are for his leadership. We stand by any wisdom he would want to make to perfect this, but I hope it would not, if we can be amended today and move forward today so we can get it across today or soon, we would like to keep it on track to get forward. But listen, no one works harder than Representative Jones, and so I certainly stand in support of his motion.
All right. Thank you for that. We will move on now. You have a question from Representative Clark.
No, I was going to say at the appropriate time I would like to make for an amendment.
All right. We're going to take up a motion on the underlying bill to begin with. No other questions from Mr. Breedlove. No other people signed up to speak. Do we have any questions? Or what's the pleasure of the committee? We have a motion. We have a second. All right, now would be the proper time for us to consider any applicable amendments. Representative Clark, I will recognize you for the purpose of making an amendment.
Thank you, Mr. Chair. My amendment is pretty simple, but it does cover a couple of lines. On line 13, we would change the number from 12 to 13. On line 36, we would change the number from 8 members to, am I looking at the wrong one? 590133.
All right, state your first change again for us.
Am I on the wrong one?
No, you're on the right one, but just state again what number you're wanting to change on what line.
Line 34.
Okay.
Am I not on the right?
All right, on line 34. Okay.
Oh, no, line 34, I want to change the number from 12 to 13. On line 36, change the number from 8 to 9. On line 39, change the number from 4 to 5. And then between line 46 and 47, I would add a bullet point 5, and it would be a certified peer specialist or a Georgia certified peer specialist, whatever language is appropriate according to Legislative Council.
Let me ask for clarification on your amendment. If you change lines 36 and 39, that would be 14 members instead of 13. And so are you wanting to increase the number of reps on the committee, or you just want to include
No,
increase
not increase the number of reps.
All
Sorry.
right, so you would leave
36
at
alone, yes.
8,
My bad. Sorry. about that.
39 at 5, and then add a new Roman numeral 5 that would say a peer certified specialist.
Certified peer specialist.
All right, so we would strike, if we were to take on the amendment, we'd also strike and on line 44, add a and on 46, and then we put a citizen representative who is a peer certified specialist.
Yes.
No, excuse me. It would go on 46. You would put comma or semicolon and then you would drop down, and that's where you would put in V. After the end of 46, you're creating a new line. That would be Roman numeral 5, and it would be a citizen who is a peer certified specialist. Does that capture your amendment?
Yes, and just to clarify the amendment, while I do appreciate, and I am, I really do appreciate that the staff of the recovery community organizations are also certified peer specialists, I don't want it to be limited to that. There might be others within the community that really could add to this conversation, including those with dual diagnoses that could. I mean, I don't think it takes away anything. I think it just adds to the conversation and the perspectives.
All right, thank you for that. We have a motion. Do we have a second? All right, now would be the time for any discussion. Representative Jones, I see your light lit up. Or is it for discussion, or is it for?
I apologize, sir. I had asked. I wasn't sure you were going to acknowledge Representative Clark for me first for an amendment. I'll wait until this is done.
Got it. Thank you. All right, number 27 is that's Chairman Jaspers.
Yes, sir, Mr. Chairman. Could member explain? I show my ignorance here. Maybe what a certified peer specialist is, how they're certified, and description of what that is.
Absolutely. Are you asking me or the author?
I think you made the
Whoever knows.
amendment, so he's asking you.
Okay,
Yeah.
just want to make sure. So the Georgia DBHDD, I'm not even going to try to say all that out. DBHDD has a program where people who have suffered from addiction, recovered from addiction, and are now able to go into the community and basically help those who are in their process of recovery from addiction, in that process. So they're like a community health worker that's not a doctor, but someone that can speak to the individual from a perspective of experience. I've been where you've been. You can get through this. It's one of those things. And so actually, Georgia was one of the first states in the country to create a certified peer specialist program for this purpose in the 90s. And so I do think that, and there are lots of certified peer specialists in the state of Georgia. I just think they would be very valuable to this conversation.
Thank you.
Can they be certified any other way except through DBHDD?
Well, I would prefer in this, it would be a person who is certified by the state. But that's usually how people get certified.
I agree with that. That's just what I'm going to make clear. All right, and of course, the speaker will certainly still have the ability at his discretion to choose who he appoints. So thank you for that. All right, we have a motion. We have a second. Any other discussion on the Clark amendment? All right, hearing none. All those in favor of the Clark amendment, make it be known by saying aye. All opposed, like sign. All right, the Clark amendment is on. I'll recognize Chairman Jones for the purpose of an amendment.
Thank you, Mr. Chairman. I would like to propose at the end of 43, after addiction, before the semicolon, and dual diagnosis.
All right. Chairman Jones has made a motion on line 43 after the word addiction to add and dual diagnosis. We have a motion. Do we have a second? Second. All right. Any discussion on the Jones amendment? All right. Hearing none, we will vote on the Jones amendment. All those in favor, make it be known by saying aye.
Aye.
All opposed, like sign. All right. The Jones amendment is added. Any other amendments or discussion? Hearing none, we will now call the question on the underlying resolution, House Resolution 512, as amended by the committee. All those in favor, make it be known by saying aye. All opposed, like sign. Passes unanimously. Thank you, Chair Lady Hagan, for your important work.
For your help in making this a better bill.
Thank you. All right, we will now take up House Resolution 592, LC 339817. Chairman Newton.
Thank you, Mr. Chairman. Thank you, committee members, for being here. Basically, this House resolution is to form a study committee to look at an issue that's used to be a challenge in my field, which is emergency medicine, where if a new group took over the contract, everybody was required to leave and go to another hospital, sometimes more than 25 miles away. I can tell you, fortunately, those are out of emergency medicine now. That makes it a lot more stability with the team that you get to work with, and teamwork is obviously so crucial in the emergency department, like so many other areas of healthcare. This is a resolution to look at non-competes and how they're used in hospital and healthcare and practice organizations. There's been a couple of things have happened. I think about a year and a half ago, the FTC actually banned non-compete clauses nationwide, partly in healthcare, but also in other fields, that they were too restrictive and they harmed patients and patients' ability to continue with a physician, especially as private equity and other entities are buying hospitals and then they're selling hospitals, and then practice groups get put all together. And so with all those corporate changes, a lot of times they were triggering non-compete clauses. For example, in my area, when Augusta University transitioned to Wellstar MCG, there was a lot of transition, and some physicians had to leave the state because of non-compete clauses. I'm not saying I have the right answer on it. There was a potential last year just to go on and ban them, but I think after looking at it more carefully, we realize there's several states that have actually taken different action. Arkansas did just a few weeks ago, got signed into law, healthcare non-compete exemption. Also Iowa, Louisiana, Illinois, Pennsylvania, and Rhode Island. A key thing about them is some of them have only been for mental health care workers, for example. Some have been no non-competes with APRNs only. And then others have banned non-competes in primary care. Some have been for all healthcare workers. What the goal of this study committee is to kind of take a look at that, look at the pros and cons. I mean, non-competes can be helpful for a health system to let them spend money to attract somebody maybe from Oregon or Illinois or Indiana down here to Georgia. So they can be helpful to protect that investment maybe for a certain amount of time, especially if they have to pay for recruiting, flying people in, all the expenses of recruiting either a specialist or a primary care doctor from another state. But at the same time, someone who maybe have been born here may go work for that same entity and have the exact same non-compete as one that the health system spent a lot of money and effort and time on. And so the goal is what's the right amount of a non-compete that can recognize the risk and the expense that a healthcare system or practice might take to attract somebody in. What's an appropriate length of time? I mean, there's been some that are 3 years and 50 miles. Some are 1 year and 10 miles. Of course, 10 miles in Atlanta is different than 10 miles in a lot of Georgia below I-16. So that's the reason it seemed that it was wise to have a study committee take a little bit of time, look at what other states might have done. All of them are trying to do the same thing we're trying to do, which is advance our healthcare workforce. But I want to make sure if we do anything that we did it in a balanced way that learned from other states' experience, especially if there's been a negative to getting away from non-competes. So that's what the goal of the study committee is, or the bill, the resolution. Certainly, seeing what we can do about how can we retain physicians in Georgia as we retract them here and then keep them here, if we can do that in a way that makes their practice more stable and most importantly, that it's the best thing for patients to have that continuity that can, especially with a primary care doctor that you develop a relationship with. So that's the goal of the study committee. I'm glad to answer any questions, Mr. Chairman.
All right, thank you, Chairman Newton. You do have a couple questions. 14, is that you, Representative Schofield? Representative Schofield, recognized for a question.
Thank you, Mr. Chair. Thank you, Representative. Just a quick question, and I really do like, and I think it's time that we look at this. How will this impact independent docs?
Excuse me?
Independent docs. Where?
Well, obviously, if somebody has just gone out and set up a practice, they don't put any restrictions on themselves on who they could go work for. Excuse me. If after 3 or 4 years they decided they wanted to go work for a large health system in their area, or somebody expanded into their area and they really doesn't affect those. One of the things is that so many of our younger doctors, though, are not choosing to take that risk when they already owe money for med school and the training and the delays. A lot of them are wanting to go work for a health system now, and some of them develop some excellent relationships with their patients. Now, for them to go out into independent practice, they may be bound by a non-compete even after 3 or 4 years, even if they grew up, a few miles away and always intended to stay. So that's the balance that we're trying to figure out. What is the right amount of protection for those who want to do this expensive recruiting, but at the same time also protection for the patient-physician relationship that develops, and how do we do that? Do we exempt just maybe primary care more or mental health more, the ones where that ongoing relationship might be different than a specialist? So
Thank you.
I hope that helped.
That's it. Thank you.
Chair Lady Silcox is recognized for purpose of a question.
Thank you, Mr. Chairman.
Yeah.
Thank you so much, Representative Newton, for bringing this. I think this is a very important issue, and I think particularly in light of specialties, especially medicine, I appreciate you bringing it. I would also love for y'all to look at not just practicing physicians or people in practice, but understand there have been some contracts with residents and fellows as well that have had restricted
include
covenants.
non-competes.
Including
You're right.
yes.
I
So would appreciate you including those doctors as well in
Yeah,
your
they are
study
MDs,
committee.
but they can't quite go out
Exactly.
on their own. But you're right, they have and residents, as great as it is to be through with medical school, you still don't have any freedom until you finish that residency. And for somebody to bind someone to one of those during residency, it can be attractive.
As well as fellowship.
Wow, that's a good point.
So
Thank you
thank
for
you so
bringing
much.
that up.
Thank you, Chair Lady Silcox. Representative Clark is recognized for purpose of a question.
Thank you, Mr. Chair. Thank you for bringing this bill. A question about the purposes of these non-compete clauses, because in your presentation, you basically said the purpose of a non-compete is retention. You've recruited, now we don't want the doctor to be able to just leave and go off after we've spent so much investment on them. But then you also said the purpose of potentially getting rid of non-competes is retention. So how do you reconcile that?
You had to notice that, didn't you? No, that's part of the reason it needs study. Is there are, and I don't know if anyone's planning to speak on the bill or not. If not, but the health systems can be, they certainly can explain the costs of recruiting to fill a full panel of all the services that a health system needs. And so, once again, a lot of times that requires a significant investment to get them here. Then it's like, is after 3 years, should the non-compete go away? Once they've had opportunity to recoup their role, and then it's up to the physician to decide, do we want to stay in this good practice arrangement that's developed, or would it be better to join with some others? I think I hate the idea of somebody being told they have to leave the metro area or leave the state as part of a non-compete. So it actually does affect both, and that's why I think it needs a little more careful study than we can typically do in our 40-day session to begin with a bill, and then I think it deserves a little more. Thank you.
Thank you for the question. Chair Lady Mathiak is recognized for purpose of a question.
Thank you, Mr. Chair. Excellent bill. I would like to be included in this too, because my profession goes through this as well. So maybe you can put all healthcare professions in there, but at the appropriate time, I'd like to propose it do pass.
Thank you, Chair Lady.
All right, I don't see any other questions, so now would be the time. Chair Lady Mathiak, if you'd like to make that motion.
So moved, Mr. Chair.
All right, we have a motion from Chair Lady Mathiak, a second from Chair Lady Silcox. We have before us LC 339817. Any further discussion? Hearing no further discussion, what's the pleasure of the committee? All those in favor make it be known by saying aye. All opposed, like sign. Bill passes unanimously. Congratulations, Chairman Newton. All right. I'm going to move back over to my chair and let Chairman Hawkins have his. So thank you, Mr. Chairman.
I appreciate it. Thank you, Chairman Kelly. I appreciate filling in. I apologize to the committee and the crowd. I was presenting a bill in regulated industries over on the Senate side, and a 20-minute bill turned into an hour and 20-minute bill, and that happens sometimes. Okay, we have up next Senator Tillery with Senate Bill 39.
Thank you, Mr. Chairman. Members of the committee, Senate Bill 39, I believe we've heard this in your committee already once before. What it states is that the Georgia taxpayer funds will not be used for transgender surgeries and care. And that is the bill in its essence. I'm happy to go in more depth. I know last time we did go in more depth about that, and happy to have further discussion if you wish to do so.
I'm not sure of the will of the committee. I'm already seeing questions. Why don't we just go to questions? I think the bill is understood. We do have an amendment to this bill, and I will just brief you on that, and that is removing Section 1 and starting with Lay Council, Section 2 becoming Section 1, and changing line 36 to line 11, and there throughout the rest of the bill, changing those lines. I believe that's acceptable to the author, correct?
That's the pleasure of the committee, yes, sir.
Okay, thank you. We've got Representative Clark.
Thank you, Mr. Chair. A couple of questions. I must have been in another committee when we heard this the first time, so I do have a couple of questions. On line 89 of the bill, it specifically talks about an exception for this bill being treatment for individuals with partial androgen insensitivity syndrome. Two questions. First, could you explain partial androgen insensitivity syndrome? And the second question is, why not also include the other types of androgen insensitivity syndrome? Sorry, it's a mouthful.
Thank you, Representative. I cannot go into the medical detail about it. If you know more about it, that's perfectly fine. But one of the things we were trying to do is we wanted to make sure that if people were born with conditions that required medical treatment, that they were able to have that medical treatment. But as far as going into further medical detail about that, I don't know that I would be your expert for that.
So I guess to follow up on that, that's why I'm confused on why it only talks about partial androgen insensitivity syndrome and doesn't include the entire spectrum of androgen insensitivity syndromes. It's very specific here. So I was just wondering the objective or goal of only choosing that particular AIS.
Right. The end goal, again, was if someone is born with they're trying to keep their birth sex, and sex is again defined in the bill, then there's no desire for the state funds that are already used for that purpose to be banned from being used for that purpose. It is more when it's being used in a transitional form.
So just a quick follow-up to that. So a lot of times people don't know they have and AIS until a little bit later in life. Sometimes it's very obvious at birth, but a lot of times it's not very obvious at birth. So a lot of times people don't find out until puberty. Something was supposed to happen that didn't happen, or something is happening that's not supposed to be happening, and there's a lot of confusion there. And so my concern is that partial androgen insensitivity syndrome is not inclusive of all of the individuals that might actually need this care based on what the objective that you just named. So I'm just wondering why we specifically pointed to that one. And then on line 51, where we define sex in the same way, the state of Georgia is basically putting the definition of sex into the code. But what happens when the sex organs and the chromosomes and the gonads and the external genitalia, what happens when none of those things actually reconcile with each other according to this definition? What, by Georgia law, is that person? Are they male? Are they female? Are they non-existent? Like, what do we do in that instance?
Right. Well, I think it would go up to whether or not they're then seeking gender-affirming care in lines 45 through 47. So if the gender-affirming care they're seeking matches the sex, whichever one you described, then if their sex matches the gender-affirming care that they're seeking, then it would be eligible for payment under the state health benefit plan. If it does not, then it would not be.
Right. I guess I'll ask my question another way. If you do not necessarily have a defined sex by Georgia law, then how do those people get care?
Well, see, I think, Representative, appreciate the question. I understood it. If they had both, then they're going to be able to seek gender-affirming care under whichever one they pick. The question, the bill, though, is tailored to if someone only has one of the sex organs you described, then they can't seek gender-affirming care as something else.
Gotcha.
Okay, Representative Clark, I'm sorry, I've got a lot of lights,
Okay.
and also,
Thank you,
those
Mr.
are
Chair.
good questions, and thank you. But also, it's been brought to my attention that we have actually not discussed this bill. You have not presented it. That was a PBM bill. So if you could go ahead and present the bill.
Oh, I thought
I think that would
I'll be
help.
honest with you, Mr. Chairman, I thought we'd already
I
gone through
know,
the
I
hearing
know.
already.
Well, me too. We've had so much discussion about this, but yeah, if you would go ahead and present the bill.
Sure. Senate Bill 39 relates to the state health benefit plan, and it states that the state health benefit plan will not pay for gender reassignment surgeries or gender care when it's related to care to a sex that is not someone's sex at birth. That is it. If the sex organs are not definable, as Representative Clark brought up earlier, then they're going to get to pick their gender care, which one they wish. But if everything is easily ascertainable and definable, then gender-affirming care in Georgia would be limited to one's sex at birth. Why then would we do gender-affirming care at all? Well, some people need hormone treatments. We're not trying to ban hormone treatments from the state health benefit plan. We are saying, though, that you can't seek those hormone treatments when they differ from your biological sex at birth.
Good presentation. I'm having trouble with buttons up here, but thank you. I think you and I have discussed this, and I watched the Senate tape, so that's what I was remembering, your presentation on the Senate side. Okay, we do have some questions. Representative Stinson?
Thank you, Mr. Chairman.
Yeah.
Thank you.
Go ahead.
And thank you, Chairman, for bringing this bill. I'm just trying to get a clear understanding. Gender affirming care. So if someone is in need of just plain care, if they're just sick and not feeling well and they just need to be cared for, how would this bill affect them? Stop them from being able to receive care by the state health benefit plan, or they are in a facility operated by the state?
I guess it would depend on what type of care you're seeking because you were sick.
Okay.
So if it's based on, I mean, obviously there's a lot of things we cover in the state health benefit plan.
Mm-hmm.
If it's cancer, if it's other diseases, those aren't affected at all.
Okay.
It's tied down to gender affirming care, which is limited to two things in the bill in lines 45 and 47. I say two things, there could obviously be more, but two big categories. Hormone therapy and sex reassignment surgery. And if you're getting hormone therapy for transitional purposes to transition to a sex that was not your sex at birth, or you're seeking to get sex reassignment surgery, the state health benefit plan would not cover those.
Okay.
I think it's limited to those things.
Or facilities operated by the state, like a state prison or something?
I think there's another bill that deals with
Okay.
state prisons.
Gotcha, okay.
But yes, ma'am.
Representative Clark.
Thank you.
I'm sorry. I got, which light are you? Which number? 16. Okay, I got you.
Thank you, Mr. Chairman. I want to say that I stand in strong opposition that seeks to dehumanize transgender people and restrict the rights of adult pediatric transgender patients to fully access the medical care that they need. And Senate Bill 39, it restricts access to life-saving medical care for adolescent transgender patients, and it will make it more difficult for some adult transgender patients to obtain gender-affirming care. And I strongly oppose any legislation that would harm the health and well-being of our transgender and gender diverse patients.
Okay, thank you. Schofield.
Thank you, Mr. Chair. Thank you, Senator. So I'm curious, based on some of the questions that Representative Clark has asked, this bill, I'm concerned about this bill and the public health research on this bill. Where is that, or is this really just a personal ideology?
I don't know that it's a personal ideology. If it passes the General Assembly, then it would be the ideology of the General Assembly. And if the votes are against it, then it's not the ideology of the General Assembly.
Yeah, I mean, where's the research? Where's the public health research that this is a problem or we should be taking this issue up? This is a decision between someone's personal life, their doctors, and their family. It shouldn't be the General Assembly.
Well, ma'am, I beg to differ. You're going to be asked to vote on a budget that we send back over to you that's going to have over roughly $1 billion in the state health benefit plan. If you think that the state should pay for transgender surgeries,
I do.
Then you should vote against my bill.
And I will. Thank you.
Yes, ma'am.
Okay, thank you. Representative Davis.
Thank you, Chairman. Before going to any committee, I go in and I do research, and I Googled gender affirming care, and ended up went to the HHS site, and let me read to you the first document that came up. It says, per court order, HHS is required to restore this document as of February 14, 2025 at 11:59 p.m. Any information on this page promoting gender ideology is extremely inaccurate and disconnected from the immutable biological reality that there are two sexes, male and female. The Trump administration rejects gender ideology and condemns the harms it causes to children by promoting their chemical and surgical mutilation into women by depriving them of their dignity, safety, well-being, and opportunities. This page does not reflect biological reality, and therefore the administration in this department rejects it. My question to you, if you are a teenager seeking care, is depressed, confused, and they go on the internet, go to the health site and read this, do you think that this would help them in any way to read such a statement as this?
Senator, I don't think my bill has anything to do with any comment that was posted on the federal HHS website.
Okay.
Is there one follow-up? When it comes to the health care of an individual, do we exclude any other care outside of gender-affirming care when it comes to the state paying for that?
Yes, ma'am. We do.
In the area of sex?
In the area of sex and healthcare generally, yes, ma'am, we do.
Okay.
Okay, thank you. Representative Lim.
Thank you, Chairman. I have a little bit of a different tact. I know you are a learned attorney, so I wanted to ask a legal question. One of my concerns with this bill is the impairment of contracts, and I know that we may or may not strike Section 1, but it is a reality that there have been settlements by our Attorney General, and to my understanding, that's been up to $4.1 million and at least, or about 19 cases either settled or lost. I don't want to get into those legal theories, but I did want to ask about the impairment of contracts. For my understanding of the law, because you're an attorney as well, as we've stated, settlements are a big deal. The settlement of an issue is important for all of the parties involved. So from my understanding as well of Supreme Court precedent and all other applicable law, you need to have not just any reason and not even any legitimate reason, but a significant, I believe, reason for invalidating those contracts, and they have to be reasonable and necessary. My question is, what is the significant purpose for this bill? And even if there is a significant purpose, is there a reason it's not more narrow? For example, why is it not limited to those moving forward that would seek to use the state health benefit plan? Why do we not, from my understanding as well from SB 140, we had a grandfather clause in there for those that were already on hormone replacement therapy. We don't see that here. It would probably be in line 90 or 91. So what is the legitimate, significant purpose? And even if there is one, why is this not more, I suppose, narrowly drawn to meet that purpose?
Thank you for the question. Contracting, I guess we could take it in several different ways here. You are correct. We have various contracts with the state health benefit plan. So Section 5 in line 118 and 119 tries to say that this only applies to contracts that move forward after January 1, 2026.
Okay, Representative Jaspers.
Just a quick clarification. So I just, especially on the meaning that anyone who, because those that were in the using the state health benefit plan would be using it in the future. I just want to clarify, does that mean that they would be able to use the continued hormone replacement therapy?
So you're talking about settlements that the state may have already entered into, not necessarily contracts that the state's entering into for state health benefit plan.
Correct.
I think that's an interesting question, Representative. I don't know that we get to decide that in our branch. I do not know the legal answer to that question.
Thank you.
Representative Jasper.
Thank you, Mr. Chairman. Chairman Tillery, the $1 billion you just talked about just a minute ago, we have to spend that wisely. Is it not true?
I hope we do.
And I know you work very hard at spending our limited dollars, and I know you've been very careful and deliberate with this bill. And the folks that you're saying in this that would this cover, these are folks, they're healthy. They're choosing to have this care, and they can still do it. It's just our dollars, state dollars, will not cover it. Is that true?
It is true that this does not outlaw the surgery. It just says the state will not pay for it.
And I think it's an important point to notice that in our state health benefit plans, we make choices all the time. I know in my tenure on this health committee for many years, we've added illnesses, maladies, all sorts of issues, maybe one a year, that it does increase the coverage for Georgia citizens.
That is true, and we've also gone the other way. We went the other way with GLP-1s at one point in time. So we've gone both ways on issues concerning things covered in the state health benefit plan.
Thank you, Mr. Chairman.
Representative Clark. Representative Clark.
Oh, sorry. There's two of us in here, so I wanted to know which one. All right. Two more lines that I didn't get to the first time.
Yes, ma'am.
On line 64, there's a list of procedures, that we are seeking to ban from, people seeking gender affirming care. And so I want to present a scenario for you because I think this is real life. We've seen this in other instances before.
Okay.
If a person is a trans male and they have internal female genitalia, so they have a uterus, and let's say they're suffering from something like endometriosis or fibroids or something that requires them to get a hysterectomy.
Hysterectomy. Mm-hmm.
But let's say they've also in the past gone to their doctor and said, I would like a hysterectomy because I would like to stop making female hormones, and therefore I think that a hysterectomy is the best care for that.
Right.
How do we make sure that doctors are not going to deny people their care because they're afraid of, oh, I did this because they're afraid that if they say they're doing it because of one reason, someone could go and look back at those records and say, actually, they told you they wanted a hysterectomy for another reason, for gender affirming care. And now this doctor is in the crosshairs of being accused maybe of providing gender affirming care when they were actually trying to provide the standard care for endometriosis or very large fibroids.
Right. Well, let's break that down on several levels, okay? I want to answer your direct question, but I also want to answer the question that I think you were kind of leaning at a little bit, and I apologize for if I'm assuming here, then you can blame me later. The thought of a doctor being afraid of this, there's nothing in this that causes any criminal penalty at all. The only penalty that a doctor would receive if they did this inappropriately is they're not going to get paid to the state health benefit plan. There's no jail sentence. There's nothing like that. I know we've gone that way with this issue before, and folks have brought that up, and I hate to use the word fear tactic. The only fear is you wouldn't be paid under the state health benefit plan. If, though, under the scenario that you brought up, a trans male that's born female needing a hysterectomy because of endometriosis, I'm sorry, I can't say the word, but I know what you're talking about, then we would go back and we would look at the definition of sex. We'd say they were born female, so they've got these issues they needed. And then under 45 through 47 for gender affirming care, I would say that endometriosis, sorry, I can't say the word, is not something that we're looking at here that's being banned because of hormone treatment, and it's not something that's being banned because of sex reassignment surgery. It's then in their health care. And it's not against the individuals or inconsistent with the individual's sex at birth. So I don't see how that would get banned under my reading. I understand that this would obviously, I don't interpret the laws, we just write them. But I don't see how you could reach that conclusion based on this bill.
So I guess what I'm saying is a lot of times individuals outside of here have to interpret the law. And we've actually seen deadly consequences to people trying to interpret the law and not providing standard care because they're afraid of getting in trouble. Now, maybe they won't get in trouble because there's nothing in here that creates a private right of action or penalizes someone criminally, but doctors do want to get paid. I mean, not many people out here working for free. I don't think you're working free. I'm not. I have to pay my bills too. And so I do think that penalty of not being paid because someone can go back and look at the medical coding and say, a year ago, they tried to get a hysterectomy for a different reason, which was gender affirming care. Now they're saying they're getting it for this reason. We're not going to cover this because the law says we're not covering hysterectomies for people who are females trying to transition to males. So that's the concern that I'm bringing up. And then, Mr. Chair, one last question, I promise. On one line.
A short one,
It's very short. On line 45, you have the definition of gender affirming care, and it uses the terms such as, and then it lists hormone therapy and sex reassignment surgery. But my understanding of legalese, and I'm not a lawyer, so it's not my expertise, is that this then is not an exhaustive list and that there could be other forms of gender affirming health care that are also that could fall under this, such as and not exclusively hormone therapy and sex reassignment surgery. So my question is, how does this affect individuals that are transgender that are just seeking psychological services and therapy and mental health care?
Right. Would those be in an attempt to affirm one's individual perceptions that would be inconsistent with one's sex?
So it's mental health care. So they're
guess,
going in for, so we're talking about a medical diagnosis, gender dysphoria. We're not just talking about, someone just walking in and saying this is actually a diagnosis. And so the standard of care actually starts with therapy and things like that. So are we now banning mental health services from being covered by the state health benefit plan as well?
If those are, potentially, if those are inconsistent with one's sex at birth, then I think the answer is yes.
Thank you.
Okay, thank you. Representative Jones.
Thank you, Mr. Chairman. To the author of the bill.
Yes, ma'am.
From what I understand, this bill would be the first law passed in Georgia that prevents transgender adults from accessing their treatments and medications. And also, from what I understand, that this bill denies coverage of gender-affirming care for Georgians who rely on the state health benefit plan, which currently covers more than 500,000 state employees, teachers, retirees, and their dependents. So this, as was stated earlier, there have been other bills that denied groups coverage or whatever was stated earlier. I may not be saying it right, but this bill here will be the first law passed in Georgia that prevents transgender adults from accessing their medications and treatments.
Is that a question?
It is a question.
Oh, okay. The answer then would be no. It is not. It does not prevent them from seeking any treatment. What it says is that state taxpayer dollars through the state health benefit plan will not help them assess that treatment.
Okay, thank you. Representative Davis.
Thank you, Chairman. One quick question. Can local governments or private employers still offer this coverage? And I'm saying that because if they use state funding,
right,
does it mean that they can be cut off?
This is only limited to the state health benefit plan.
Thank you. Okay, I see no more questions. We have a number of people who signed up to speak. We do have this room until 11:30, so we have 30 minutes, and we've got a lot of people signed up, 20-something people. So you will have 2 minutes to speak to the issue, and let's start off with Amanda Seals. If you'll go to the podium.
Thank you, Chairman.
Go ahead.
My name is Amanda K. Seals. I'm a partner at the law firm of Bonder at Mixon and Elmore. I was proud to have represented the plaintiffs in Rich v. Georgia, which is the case that resulted in a settlement that this bill would try to undo. To answer Representative Lim's question, this does impair contractual obligations on the part of the state and therefore poses constitutional problems under the Contracts Clause because it would undo the promises Georgia has made in the settlement in Rich v. Georgia, in which Georgia was obligated to lift the exclusion that previously existed and not to reimpose it. It poses other constitutional problems in addition to the Contracts Clause problem because it violates the Equal Protection Clause. The Fourth Circuit has already struck down a similar provision in North Carolina. The 11th Circuit has struck down a exclusion under a county, a local government health benefits plan in this state. And it poses Title VII problems. The case of Bostock versus Clayton County establishes that. Georgia has settled these cases for millions of dollars, not out of the charity to the plaintiffs. It's because these exclusions are legally indefensible. And you will be sued again. The state will be sued again if this bill passes. And again, the exclusions will be legally indefensible. You will spend more money litigating over these exclusions than you would offering this care to state employees and their dependents. It's bad policy and it's bad law. And I would urge you not to pass it.
Thank you. Up next, Carrie Scott. Carrie Scott? Okay. Joanna Schwartz.
Chairman Hawkins, Chairman Tillery, and the board, thank you for this opportunity. This is not a simple bill. As a Georgia native, lifelong resident who cares deeply about my state, as a professor in Middle Georgia who has achieved, a great deal in the classroom and received the state's highest teaching honor of being in the USG Teaching Hall of Fame, as a state employee who would be personally affected, and as a state employee who pays almost $10,000 a year in premiums for my health insurance coverage for myself and my family. I ask you, I beg you, please do not advance this bill out of committee. Chairman Hawkins, in your own words, this committee has two purposes. One is the state's interest, one is the interest of the people of the state. The state's interest isn't served by spending more money on legal defense than it spends on the actual care of its own employees. The bill is discriminatory in nature. It disallows patients to seek treatment by their doctors. It also is not in the interest of the people of the state. It doesn't just state employees, but their families. Chairman, one of the things you've noted is that teachers and many of the people who work for the state do that with a servant's heart. We don't do it to become rich. We do it because we believe in the importance of the job, which means that I don't have the benefit of not being able to have insurance for my medical treatment. If I need to see a therapist, it means now that that wouldn't be covered. Things that would be covered for everybody else on this board would not be covered for me. As Dr. Burke had noted before, this committee is dedicated to minimizing member abrasion. This is a sandblaster. This affects a small percentage of the people who work for us, but it affects them deeply, and it impacts the ability of the state to be able to recruit and
Okay. Thank you very much for your testimony. Appreciate it. Up next, Dr. Jason Snyder.
Thank you, Mr. Chairman. My name is Jason Schneider. I'm a local physician that provides care to transgender and gender diverse adults here in the metro Atlanta area. This bill, Senate Bill 39, would cut off the best practice medical care for transgender people of adults that I care for. Some on the state health benefit plan. I don't think much about insurance coverage when I've seen patients in front of me. But the point here is the government should not be able to overrule a person's decision to seek health care for themselves and their families, whether they are transgender or not. And this would allow, this bill allows politicians to interfere with private decisions between me and my patients, my adult patients. It's important to know that the American Academy of Pediatrics, the American Medical Association, the American Psychological Association, and every other leading U.S. medical professional association recognizes and supports this care. Just this morning, I pulled title pages from 3 different articles that demonstrate improved mental health outcomes for gender-affirming care, for both medical and surgical care. These are not simple decisions I make with my patients. We have conversations. We talk about risks and benefits. Okay. The last thing I want to say, we've talked a lot about cost. This population is well below 1% of the population of this state. The medications I prescribe are not expensive. And then if you want to talk about reducing costs of surgical care, focus on reducing the number of coronary bypasses that our citizens have, not on gender-affirming surgery. Okay, if you really want to reduce costs for the state health benefit plan, work on preventive cardiology, not on interfering with the care I offer to my patients. Thank you, Mr. Chairman.
Thank you. Up next, Jeff Graham.
Thank you, Mr. Chair. My name is Jeff Graham. I'm the Executive Director at Georgia Equality. We've had some very robust debate and discussion on this bill already today. I do want to make sure that if we are looking in terms of pragmatism and cost, the Atlanta Journal-Constitution recently produced an article that I will share with the committee today that looked at the cost of these lawsuits. Since 2015, there have been numerous lawsuits against the state of Georgia, including lawsuits that have been settled on this exact issue. The state of Georgia has never won one of these cases. The cost to the taxpayers is $4.1 million in settlements and legal fees. If you move forward with this legislation, you will continue to add to the burden of the taxpayers. $4.1 million in taxpayer funds to defend unconstitutional laws is far higher than the cost of providing medically accurate, quality care to the employees of the state of Georgia and their dependents, to ensuring that you uphold the rulings of numerous courts at numerous levels. I urge you to oppose Senate Bill 39 due to the cost to the taxpayers, the cost to the transgender community in terms of access to medical care, and what it says about overseeing and trying to interrupt standards of care that are set by medical professionals. Thank you.
Thank you. Up next, Bentley Hudgens.
Hi, my name is Bentley Hudgens. I use they, them pronouns. I'm the Georgia State Director of the Human Rights Campaign. And on behalf of our 3 million members nationwide and over 200,000 members here in Georgia, we oppose Senate Bill 39. I just have a question. My friends who testified before me hit a lot of the points I wanted to talk, but why? Why? What is it about transgender Georgians that make you want to introduce legislation like this? Why do transgender Georgians deserve health care less? What about them makes you think that they are less worthy than you? We've already said that the state of Georgia has paid $4.1 million out in settlements. We've already said that the state of Georgia has lost every single case they've fought. The author says that this bill doesn't stop transgender state employees from accessing health care, and that's misleading. We all know that in this country that health care is expensive, and without insurance, it is really hard to access. So when people are paying thousands and thousands of dollars in premiums for the insurance that they've earned by working for the state, and just to tell them that best practice routine health care is no longer afforded to them because of who they are, that is just plain discrimination. Senate Bill 39 would make sweeping changes that would cut off best practice medical care for adults. We have seen this on its face. First, you guys were talking about kids. We're talking about adults now. What is it about transgender people that makes you want to discriminate against them? That's my question. This bill is unconstitutional. It flies in the face against 11th Circuit rulings. It's going to cost Georgia more money when you're trying to save money, apparently. What is the purpose? To me, and what a prima facie on its face, this is discrimination, and we ask you to oppose Senate Bill 39.
Thank you. Up next, Kara Hayden.
Hi, so I'm a state employee. I've been part of the state health benefit plan for almost a decade now. I have transitioned. I am a transgender woman. But this bill seeks to take away care that is medically necessary. There's a lot of, past the bill being discriminatory at its basis, there's a lot of questions that aren't answered. He says, what sex assigned at birth? My birth certificate says I'm a female. How are you going to define sex assigned at birth? Are you going to require everybody to show their birth certificates when they go and get insurance? I require hormones. I don't produce hormones anymore. So this is essentially taking life necessary care away from me. boggles my mind as a Georgian. I've been in the state since the first grade. I've grown up here. Where is the care for community? Love your neighbor as you love yourself. Treat others the way you want to be treated. This is specifically targeting a very small group of people for no apparent reason other than trying to save money. Where was financial analysis on any of this? I'd love to see numbers that say how much this is going to save the state. How many transgender people are members of the state benefit plan paying into this that would be covering the costs for other people? I'm a team leader. I'm a people leader at my job. I manage people. There's hundreds of people where I'm employed that support me and accept me and have no issues with me seeking care that's necessary for myself. So I really think that you should dig deeper into this, not even if you're considering taking this on, dig deeper and get into some of these specifics that aren't answered. But overall, it's a discriminatory policy and it should just be opposed altogether.
Thank you. Up next, Jordan Black.
Good morning. My name is Jordan Black, and I stand today to ask the committee to vote no on SB 39. A few weeks ago, on February 11th, I was watching the Senate committee meeting for SB 39 while I was at work. As I listened to doctors and parents advocate for the importance of gender-affirming care, I was waiting for a phone call from my husband. He was also downtown at Georgia State University defending his dissertation for his PhD in English. His defense was successful, but our celebration was tempered because instead of being able to focus solely on the culmination of years of his hard work, we also had to wonder what the consequences of SB 39 moving out of committee would mean for our family. Our oldest child is transgender. This facet of our kid's identity is but one piece of information about our child who is a vibrant, loving human being. And since our child's social transition began over a year and a half ago, I have had to share milestones and mark time with the passing and fortunately defeat of the harmful and discriminatory work of legislators and other committee members who have decided that bullying transgender children and adults in Georgia are top legislative priorities. My husband's job in the University System of Georgia provides our family's health insurance. We happily pay almost $1,000 a month because we have been satisfied with the level of care provided so far. But the sponsors of this bill want to create a system where transgender children and adults receive less care and coverage because of discrimination. I serve on staff at a local church, and I love my job and my team. However, my job does not include any additional health benefits to employment, including access to medical care. My husband and I were actually relieved that health benefits were not included in my job offer because that meant we would not have to pay the $1,200 a year penalty for choosing to be on my spouse's state insurance instead of the one offered by my employer. We want to continue to pay and receive the full benefits of my husband's policy for our family. Gender-affirming care is safe, life-saving, and necessary. You have the opportunity today to stand with hardworking families like mine, made up of people who serve this state, love their communities, and also safeguard the beauty and health of our transgender loved ones.
Thank you. Thank you very much. Robin McCoy.
Hello. I just wanted to address something specifically about this bill that Representative Jones and Representative, I forgot your name, Davis brought up specifically about the bill, talking about how it is taking away potential health care for trans adults outside of the state health benefit plan and how also other funds go into it. Section 4, I do believe it is now Section 3 with the amendments that the committee made today, does state that no state fund shall be expended for health benefits coverage. That includes coverage for state gender-affirming care as provided for in Code Section 45.18.4, and no healthcare facility owned or operated by the state and no physician or other healthcare provider employed by an agency or entity of this state shall provide gender-affirming care as provided for in Code Section 45 45.18.4. So it goes further than just the state health care benefit plan. It goes further than just that. It is trying to take away health care for anybody transgender in the state, whether that is adolescent or adult. As a trans woman in the state, as someone that was born and raised in Georgia, someone that loves the state, wants to live here, wants to have my life here, wants to be able to call this place my home, come back here time and again and call this my home. This is worrying to me. This is one step taken closer to being able to take away my ability to live here, call this state my home, and continue to make my life here. I would just ask that that this committee stands against this bill, and that is all I have for you today.
Thank you. Brooke Mills.
Good morning. Now, I thought about making an emotional appeal, but let's just cut to straight to the line items on the LC. Now, are we still working off of LC 1061S, or have we moved forward with the amendment into a new LC?
We're working on 461061S SCS.
Fantastic. I would have hated to have gone through figuring out what line does which all over again. So I do have to address first, I believe it was Representative Lim who was, I think it was you actually, Rep. Clark, who asked about receiving surgery in relation to non-gender affirming care if you're a trans person. Now, I wasn't going to talk about personal experiences up here, but I'm a survivor of testicular cancer when I was in my early 20s. Fun genetics, hi. But because my insurance is really fun, my orchiectomy was coded as gender affirming care, so they had to pay out less, and I was on the hook for a bit more. So despite that, under this bill, I'd be fucking dead. And sorry about breaking decorum there. I just am very attached to continually living. Now let's address the individual lines. On line 51 through 55, under the new definitions of sex, it is in violation of current federal statute Washington v. Trump, and these are the sex definitions established under Sony Perdue. Now, the former governor has been described as many things, but not woke. Now, the lines 56 through 58, because of its definitions for sex reassignment, for the line of such as, good catch, I think it was you Rep. Clark, it would include for insurance coding purposes therapy, and the Senate did have an opportunity to pass an amendment providing an exclusion for therapy. That was not the case, and that was probably why 200 doctors came together in a 24-hour period within the state of Georgia to denounce this bill. For lines 105 through 107, I've had to talk this over with several paralegals, and it has taken us 2 months to work through the Georgia funding structure, so that's a fun one. It would ban Grady currently from offering out-of-pocket gender-affirming care to Georgia residents. And for lines 103...
Oh, thank you, Brooke.
Nope.
No.
I still need to address the Medicaid ban and the insurance ban, because we operate under an ACA 1332 waiver, pass-through waiver for the Georgia exchange. So, under USC...
We need to hear the next speaker. Thank you. Aaron Baker.
Hi, thank you, Mr. Chair. If we haven't met, I'm Erin Baker, she, her. I am a trans woman. I am not a state employee. I currently work at a Fortune 100 in Atlanta as an AI software architect. One thing that people don't talk about enough is that gender dysphoria is a debilitating condition even before it's been diagnosed. Before I transitioned, before I knew that that was even something that I needed to do, I was highly anxious, socially awkward, and perpetually depressed. But after I started hormone therapy, my life completely changed. I went from being socially awkward to outgoing. I went from being anxious to being excited. My performance at work improved dramatically, and I received promotions and accolades. And medical treatments for gender dysphoria have been essential to my success. These medical treatments are endorsed by the American Medical Association and the American Psychiatric Association, but most importantly, they are covered by my company's health insurance plan, because when trans people receive the care they need, they become healthier, happier, and more productive. The data is clear. Gender-affirming care leads to better mental health outcomes, improved workplace performance, and greater well-being. Companies like mine know this and provide coverage because it benefits both employees and the organization. State employees deserve the same opportunity to succeed and contribute at their fullest potential by providing access to medically necessary care. The state can foster a stronger workforce where every employee has the support they need to succeed.
Thank you.
Thank you.
Up next, Mac Purnell.
Mac Parnell, Executive Director for the Georgia Faith and Freedom Coalition. We're in full support of Senate Bill 39. This is a simple bill that really turns back the clock to what the state health benefit plan covered just a couple years ago. Thank you so much, Mr. Chairman, for hearing this bill, and thank you so much, Chairman Tillery, for carrying it. Thank you.
Thank you. Okay, Senator Tillery, would you like to do a wrap-up?
Mr. Chairman, I think the committee's heard the bill. I'm not sure that my testimony or anyone else's has switched their
I
thoughts.
was just making that offer. Okay, do I hear a motion? Second. All those in favor say aye or raise your hand. That's 7. All those opposed, raise your hand. That's 7. Chair votes in the affirmative to break the tie. We are adjourned.
That was 8.
Huh? Did I miscount?
Yes.
What did you have? Wait, hold on. What did you have? Raise your hands again that are in the negative. 1, 2, 4, 5, 6, 7, 8. You got 8. Okay, all those in the affirmative, raise your hand. What do you got? You got 8? I got 8 too. Okay, 8 to 8. Vote. Chair votes to break the tie. The bill passes. We are now adjourned. Thank you.